So, but what a horrible thing that we have that happen in our Senate. When I was growing up, I don't know about the rest of you, but when I was growing up, I learned that our branches of government, especially in the Congress, were balanced between the Congress with its 2-year terms and 435 members, because that was most responsive to the people, right? They were going to turn them out and turn them over, and they were going to have to listen to the people. Okay, now in the Senate, what I learned was we were going to have all these learned people, right, who would have, they would have 6 years so they could settle into the issues and really think, and really do the right thing for all of us and be the statesman. And I think it used to be that way. I think there was a time period in this country when there was some of that going on, although never as much as we'd like to romanticize, but I think that was one of the ideas of the formation of the nation. So here we have the Senate now today that's nothing like that. In fact, your likelihood of staying in the Senate until you become very old has more to do with how much campaign support you get from special interests than it does whether or not you have a great mind. And I hate to single out Max Baucus, but you can't hardly help it, can you? but this man is not the smartest man in the country, right? You listen to him and you think, oh my goodness. This is the man who runs the Senate Finance Committee, and I listen to PNHP docs all the time who could run circles around Max Baucus and their knowledge of financial matters, and you're doctors. So for goodness sakes, it just is, we've got to change the Senate rules. So those political efforts we need to do. We need to fight on a state level. We need to find single-payer leaders, nurses, docs who want to run and get them elected, target some races, and send a strong message that if you don't do what you said you were going to do for us, we're going to put you out. And we need to do it with 1 or 2 candidates to show that we will, and show that the people are going to stick by their word. Then advocacy going forward. What do we do going forward about our movement? What do we do about our movement? We saw what powerful stuff we saw this year in so many different ways. I mean, from the incredible energy that those brave Baucus 8 put forward, and I was lucky enough to be in the chamber that day when that unfolded, and it was quite a remarkable display of democracy. It really was. And to sit there and watch that happen, infused an energy into the process that had not been there, that was a brilliant move, and just a wonderful move for all of us. But then there was a lot of work that went on behind the scenes. We all know it. Quentin Young, cultivating his talking with different congressional members, and Ollie Fine talking with Representative Weiner. And if we think back over the last several months, this really was a collective effort of the people in the streets and the people speaking up and the doctors working behind the scenes, what they could do with their representatives, to the nurses doing all their advocacy with nurses in the streets, to just a wide range of activity. I don't think we've had that level of activity on single payer before. I think that was quite remarkable. And I think we have to be proud of that, and we have to keep our membership positive and energized by that. This is a long struggle. We often try and remind each other at CNA that this is a marathon, not a sprint. And that, even though a lot of us, you work so hard, and sometimes you think, if I just, especially in my case, if I write one more piece, maybe that's going to be something that'll tip one mind. But we're not in this alone. We're in this together with each other to make it happen, and we're going to slog it out, and we're going to keep going. But how do we make sure our advocates stay energized? They're going to feel badly if something passes that isn't anything like what they want to have happen. They're going to be upset and demotivated a little bit. I think we can learn a lot from our friends in Massachusetts and watch a little bit about what happened to their single-payer movement. It's still quite alive. It's growing more than ever now. But immediately after Massachusetts law was passed, they pulled back a little, had some discouragement. So it's up to all of us who are leaders in our own movements to energize each other, to pat each other on the back and say we need to move forward. It's also up to all of us to bring our divergent groups together and to celebrate each group for what it contributes to the effort. Sometimes, I know you feel it, I feel it, I see a lot of competition sometimes. This group's going to be the one, or this person's going to be the one, or this effort's going to be the one, and it's so different from an everybody in, nobody out mindset sometimes. And I think we forget to celebrate. There are going to be those people who want to do civil disobedience and are energized by that. That's awesome. We should celebrate and praise that. But there are going to be other people who want to do advocacy in quieter ways, not less effective ways, just quieter ways, and we should celebrate that. There's going to be people who want to do more educating in their own communities and do what we want to celebrate that. So we need to find ways to celebrate those things and move forward as a movement and not beat up on each other for what one group did, one group didn't do, and how we need to just make that happen. And I think PNHP and CNA and Healthcare Now really are the three groups that really have led the single-payer movement, in my estimation. Those three groups have really been, so it's incumbent upon us to lead this movement through this period. I really believe that. What I'm going to ask my friends at PNHP, my doctor friends, and I know you already do this because I see it all the time, showing courage within the medical community, and I know you do this, is so important. It's important more so than you could ever know, not just politically, but I know the doctors, even the ones that I see, I make sure the doctors that I see support a single-payer position because you bring a different kind of caring to medicine than people who don't. It's just that real. And it's that real for patients, too. And when you share that within the medical community, if you can convert even 10% more of your fellow physicians, your voice gets stronger and stronger, and it helps the whole system be better from a patient perspective and a political perspective. And I know you take that seriously in what you do in medicine, but I don't think I can overstate how much it means to a patient to know that what motivates you, we all need to make money. We all need to make a living. We know that's a reality. But when I sit across from a doctor whose motivation is to care about the human being that's sitting in front of them and to care about the nation enough to have a healthy system that allows the practice of medicine to really be the art that it should be, and it is, it makes a world of difference. That in itself is healing. I always tell people when I write my book, the title of it's going to be Dignity Heals, because it does. And PNHP doctors exemplify that more so than any group I've ever seen. I've been now, Katie probably gets weary of hearing me say that, I've been in 43 states in the District of Columbia now, and very few places where I haven't been literally and emotionally and mentally embraced by a PNHP doctor. That's powerful stuff that you bring to this movement, and I hope that you'll grow that in the movement and keep bringing it to the movement. It brings your brains and your hearts, and we need that. That's what this fight is all about. So we need to educate, move our policy with political effort, advocate for and with one another effectively, and show great courage. Those are the things I think we need to do going forward from here. And if I had to predict how long it'll be before we'll extend Medicare for all to this country, I'm going to be alive to see it. And I'm 55 now. So if I live my normal lifespan, let's say I get this anemia all taken care of and enough units of blood, I'm hoping 15 years. I think 15 years or less, and we're going to have Medicare for all in this country, and I will be able to lay down and rest, and that would be very nice. Thank you all very much.